What's going on, everyone? Happy Thursday. Hopefully everyone is doing well, staying safe, healthy, and having a great day so far, and hopefully testing negative for the viruses. It is time now for the Thursday edition of the Virus Update for Thursday, June 26, 2025. If you're new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. Let's face it, there's a lot of viruses out there, and you need to be informed of what's going on with these viruses. That's what I do here on my channel each and every day. So if you're new, subscribe down below. Hey, we've had a lot of new watchers lately, so hit that subscribe button. And of course, if you like today's video, give it a thumbs up. Let's try for 175 to 200 like button hits. Of course, share this video with anyone you know, and leave your comments down below. Already, we got a ton of things to get through today. I think this is going to be another one of those 20-minute videos. It's Thursday. We have a lot of weekly updates, some international and some right here in the United States. Starting off with a name you hear about all the time here on the channel. I share a lot of his stuff. It's from Dennis the COVID Info Guy. Go follow him over on X if you have not done so. This is his weekly New South Wales respiratory surveillance reports, week ending on June 21st. 2025, the COVID positivity rate there, it went up once again, 8.9%. Not as big of a rise, but I'll show you why it may still be concerning, because wait till you see wastewater. Number of laboratories reporting COVID, 2 out of 4. COVID cases, 4,082, that's up by 17.5%. Influenza, 4,880 cases, and that's up by a whopping 30.9%. That's a big increase. RSV, 2,729 cases. That's up by 0.8%. Taking a look at the variants there. Now, you're going to notice one thing here. NB 1.8.1 is at 64%. LP.8.1, that's also listed at 12%. XEC, 6%. JM.15%. KP.33%. The thing you'll notice is no mention of XFG. So I don't know if it's under the other category, which is at 10%, but XFG is not really in the picture yet there. All 4 wastewater regions, yeah, all 4 of them are up this week. And when we take a look at the charts here, you can see there's some pretty significant rises. So in this case, go with wastewater, not the small increase in positivity rate. Wastewater would suggest, things are not going so good over there at this time. Alrighty, the next few things we're going to take a look at are in relation to measles. Virginia's 3rd measles exposure confirmed at Dulles International Airport. Yeah, yet again, an international traveler heading to North Carolina via Dulles International Airport was confirmed to have measles, the third such case in Virginia in recent weeks. State health officials confirmed on Wednesday. And remember, there was a case in North Carolina. I think this may be connected. I don't know. We'll have to see what happens. There'll be a post with all of the news stories shared today, because there's quite a few of them. 2 new cases of measles confirmed in King County. This is in Washington. The state of Washington is now up to 10 total cases so far this year. So yes, looks like this exposures could be between June 14th and June 20 at multiple locations. You want to read all about the locations? Again, there will be a post today. All right, Utah. You know, we've seen this before, where a state reports 1 case of measles, then it becomes 2, and 3, 4, and so on. And, well, Utah may be starting that direction now. New measles case identified in Utah. First child diagnosed. And in this case, it looks like Utah is now at 5 cases. And so far, 2 of the 5 people were hospitalized due to complications. And they have since been released. But yes, measles is becoming more concerning now in Utah. You know, Texas has slowed down, but hey, there's some other states such as Utah, and who knows, maybe more will start to pick up the pace as well, because that seems to be a theme. 1 case leads to another case, and sometimes they're not even connected. All right, whooping cough. This is not good. Japan. We're going international again. Japan. What is going on with your whooping cough cases? Whooping cough cases in Japan exceed 31,000, an 8-fold rise from 2024. Now, we've seen increases here in the United States, but mind you, Japan has a lot less people than the United States, but yet they have a lot more cases of whooping cough than the United States. And yes, I know, someone's getting ready to type saying, we probably miss cases here in the United States. You know what? I agree with you. I think it's likely we miss cases in the United States. I mean, how many people don't even bother to go get tested? But yeah, this is already passing numbers from previous years. We're only at June 26th, so this is really concerning. Let's read a little bit. More than 31,000 people have caught whooping cough this year in Japan, a nearly eightfold rise from last year that has already surpassed the annual record high number logged in 2019 by a National Health Research Institute showed Tuesday. It does appear that Japan does update these numbers weekly, because, or at least maybe every other week, because I've been seeing pretty frequent updates on this in Japan, more so than here in the United States. All right, we have to move over to something with chronic wasting disease, and I believe we got a couple things for this. First, 3 cases of chronic wasting disease in deer found in Montgomery County. This is Montgomery County, Maryland. There's a lot of Montgomery counties here in the United States. 3 of 62 white-tailed deer sampled during 2024 that tested positive for chronic wasting disease were found in Montgomery County, according to the Maryland Department of Natural Resources. Chronic wasting disease, it's still a problem, but hey, a little bit of good news, and this is actually some surprising good news, considering if you've been following the political world. I'm not going to go too deep into this, but if you've been following the political world, funding's been hard to come by. Well, take a look at this. USDA announces funding for chronic wasting disease control prevention. That's right, the U.S. Department of Agricultural, Animal, and Plant Health Inspection Service, APHIS, late last week announced it will provide $12 million to state and tribal government, research institutions, and universities to control and prevent chronic wasting disease. This money will boost surveillance, testing, management, and response activities for the fatal prion disease. Yeah, so this is some really good news. If you want to read this full thing, again, there is going to be a post on my site today. Let's get today's update out of India. Looks like they have active cases, 3,625 active cases at this time. Not seeing where it says the number of deaths. Oh, yeah, actually I am. So it looks like they have 4, 7, looks like 8 new deaths since yesterday are being reported in India. All right, we have something else from Dennis, the COVID info guy. We are going to take a look at Canada numbers in just a minute, but hey, we actually have something to talk about in Canada. We haven't talked about one of these in a long time, an individual story about a COVID outbreak. And this is at the Sudbury Hospital in Canada, cardiac unit. And masking at the hospital, get this, masking at the hospital is optional except on units experiencing an outbreak. The number and severity of cases is not known. But hey, at least they are being public, that saying, hey, we have an outbreak. We better alert people to let them know. That is a good thing that they are doing that. With that news, now let's take a look at the viral activity levels. Let's refresh it in case it updated for Canada. COVID-19 is moderate. Flu A, Flu B, and RSV are all low at this time. Taking a look now, where do we want to go next? We do want to take a look at the website real quickly. I don't think I have anything to show you over here today. No, nothing really new that I want to show you. But if you're new to my channel, go check out my website, datareport.info. You can see it right here. And it's just a huge resource for information, COVID studies. If you want to see news stories used in past virus updates, well, you just click on virus updates, news stories, and post. There's several of them here. I don't do it every day, but I do it most days, and I will be making a post today. All right, now for the update from the UK. Here we go. Weekly cases in the UK. They're up once again. And remember, the UK has a lot of people that do not test or use the at-home test. So this is just only a small number of the cases that there are there. 1,292, that is up by 50 or 4%. Deaths are coming in at 60. That's down by 8. Patient admits, it's saying 947. I believe that's the same number from last week. And I have to show you this. Take a look here. Yes, the positivity rate in the UK continues to rise at this time. It is now up to 6.77%. That is not a good thing that it continues to go up at this time. Taking a look at this from Purple Air, and we're taking a look at what is going on with the air qualities for today. And you'll see here, yeah, take a look. There's quite a few bad air qualities in the east still. This just remains a problem. But the rest of the country doing a little bit better. Yeah, there's still some yellows and oranges in the southwest, but not as bad as we were seeing yesterday. All right, do we have any heat-related illness news today? I don't think we do. I thought we did. I don't know. Maybe I didn't include it. Taking a look at the breathing index, this is still a problem here on the East Coast. Also a problem in the Four Corners region as well. So that is not good whatsoever. Taking a look at this, tree pollen continues to lift to the north. And taking a look at grass pollen here, we can see, yeah, grass pollen is still a problem in a lot of areas. And I could have sworn we had a heat-related illness story. I think I decided not to include it because we have so many things today. Maybe we'll get to it tomorrow. Take a look at this. Philadelphia, I'm pretty sure they did release. So yeah, there we go. 936 incidents once again reported in Philadelphia on Wednesday. That is just not good whatsoever. Heat-related illness, it's a large portion of this. Let's check out Pinellas County, Florida. We see Pinellas County, Florida is dealing with a lot of calls right now. We do see sick persons shown at least 3 times. Coming back to Pennsylvania, we do see, look at this, dehydration is showing up in Upper Marion Township, Pennsylvania. There you go, another heat-related illness. Taking a look at what's going on in Chester County, Pennsylvania, we're seeing stroke show up several times. Sick person, hemorrhaging, yeah, just a whole bunch of things right now. Speaking of heat-related illness, which I have mentioned several times now, let's pause and take that hydration break, shall we? Because we have a lot more things to get through. Alrighty, water was a drink of choice today. Doesn't that feel much better? Checking on the hospital situation in Pennsylvania, and I do need to refresh this, and I am seeing some yellow here. Chester Crozier Medical Center. We won't worry about that. That is closed. Taking a look at what's going on, some of these other hospitals. I'm seeing emergency department overcrowding several times. Also seeing behavioral health diversion show up multiple times as well, which is never a good thing. Taking a look at New Jersey now, and let's refresh this. We got 2 things from New Jersey today. First off, CarePoint Health in Hoboken is dealing with a facility divert facility temps uncontrolled. Does that mean they're having an air conditioner problem? I don't know. Okay, that's it. That's the only problem for New Jersey today. And taking a look at the weekly update from New Jersey today when it comes to the viruses. Emergency department visits and hospital admissions remain low for COVID-19, influenza, and RSV. Recent COVID-19, influenza, and RSV hospitalizations have mostly been reported in 65 years and older. 5 fatal influenza pediatric deaths reported this season. The test positivity remains elevated for some of the viruses. Levels of COVID-19, influenza type A, type B, and RSV in wastewater are low at this time. LP.8.1 is still the dominant subvariant. We saw that here in Pennsylvania as well, and I've been saying this before, and I'm going to continue to say this. I think places that are seeing LP.8.1 dominant are still not rising yet, because that subvariant really didn't do much of anything here in the United States. So once some of the other variants start taking over, I think that's when there's going to start being more states coming in with problems in Pennsylvania, New Jersey, and others as well. But we also should mention this. 10% of specimens sequenced in the week ending in 5-17-25. Wow, we're at the end of June. That's really outdated data. Had the NB.1.8.1 variant. NB.8.1.8.1 is part of the Omicron family, and current vaccines and pre-existing immunity should provide some protection against severe illness. We talked about that yesterday as well. So they're saying 10%, but mind you, that goes back to May 17th. Chances are probably close to a takeover pretty soon. And when that does happen, eventually XFG will come into the picture, and that should take over as well. So when all that happens, that's when New Jersey's going to really start to rise. They had a little bump up post Memorial Day weekend. I think the next one's going to be post 4th of July, and at that point, yeah, one of those newer variants could have taken over. All right, New York State. We need to refresh this. New York State. It is New York City Day, and no big jump. Look at this. 421 positive results. You know, I really don't know what the percent of cases are for NB.1.8.1 or XFG in New York. Some are saying NB.1.8.1 may have taken over. Some are saying it hasn't. I honestly don't know. And if it did take over, you would think we would start to see a rise, but we're not yet in New York State. 421 positive cases. And since it is Thursday and it's New York City Day, first off, here's the statewide hospitalizations. Pretty much the same as yesterday. 238 in the hospital, 29 in the ICU. That's a really low and good number. Let's take a look at hospital admissions. Yeah, that's still dropping at this time. A little bit higher this week, but again, not terribly concerning. And since it is Thursday, let's take a look at New York City as well. And we can see New York City kind of held steady, maybe dropped a little bit for admissions. And yeah, look at this. So they saw that rise. That was probably when maybe NB.1.8.1, whatever it is, took over. And probably it didn't do much because look, it's dropping. And now when XFG comes into the picture, which may not have taken over there yet, that may be a different story. Hey, if anyone knows anything or has anything to share with me on what the percentages are in New York State, let me know down below. I know New York City does do a page for it. It doesn't always update, or at least last time I looked, it was pretty far outdated. I'll check it out again today and get back to you on that. All right, we do have some things from CJS, and then we want to take a look at Ohio and some wastewater as well. First off, this is not good news. Florida has passed 100,000 COVID deaths. Yeah, that's a big, bad number. Some other states already, I think California was already past that, but hey, now Florida has passed that as well. I mean, it's a population thing. Some people say, oh, it's only the blue states that are bad, or it's only these states. No, no, no. The states that have the higher population are going to have the higher number of deaths. That's just the way it's worked. They also have the higher number of cases. I mean, where there's more population, you have more COVID. And Florida has now passed 100,000. California did it earlier because look how many millions of people live in California. What is it? 30 million people living in California? It's more than Florida, although Florida is a growing state. Florida now passed 100,000 deaths. All right, some other numbers. Tuesday's numbers. Florida had 992 new cases. New York had 273 new cases. Puerto Rico, 111 new cases. Maryland, weekly number, 382 new cases and 8 new deaths. Virginia, 682 new positive tests and 1 death reported by the CDC data tracker last Friday. Wednesday numbers. Florida. Yikes. Florida's really going up for cases right now. Daily number. 1,108 new cases and 4 new deaths. One of those deaths is from 2023. New York. Daily number. 277 new cases. Again, New York, I'm not concerned yet. Post 4th of July, I think it's going to be a different story. Puerto Rico, 1,229 new cases, includes much of what would have been reported yesterday. So that 111 the previous day, that was an off number. Michigan, weekly number. This may be the last we see from Michigan for a while, and we may see the last of their deaths for a while as well. They got a new dashboard in the works, but I don't know how much information is going to come from that new dashboard or when it's going to come. 402 new cases and 4 new deaths, and he says here, per the state, this is their final COVID cases and deaths update. Hopefully not for good. Nevada, weekly, 2-week update, 361 new cases. Oregon, 245 new positive tests reported over the past few weeks. A test case positivity rate for the week of June 8th through the 14th of 4.1% and 4 deaths. Washington, weekly number, 330 emergency department visits and 4 new deaths. So, yes, things are trending in the wrong direction in some places, especially Puerto Rico and Florida at this time, where Florida has now passed 100,000 COVID deaths. Take a look at this. Ohio's weekly update, and this is new one. Yes, it is. RSV, 8 hospitalized. That's a little up from the previous week. Flu, 15. That's flat. COVID, 60. That is down from the previous week. All right, let's take a look here at wastewater. We can see high levels in the south, low in the northeast, low in the Midwest, and medium on the West Coast. This is for COVID at this time. And I want to show you, we have another orange site that has showed up today. It's Woodlands. This is just northwest of Houston. I don't think this is a terribly big, 70,000 population. And you can see here, COVID's coming up high. It is rising at this time. Concerning, another wastewater site has joined the high category And I think we're going to continue to see more go medium and high, especially as we get further into the summer. And once we go into July, well, we're going to see a lot of places because we're going to have people that travel all around the country to celebrate America's birthday. And then they're going to go back to where they came from. You know, some people will take the full week off next week for vacation. And they'll come back and, oh, my throat's starting to get scratchy. Oh, I got a headache. And, oh, it must just be a summer cold. No, chances are you're going to need to take a COVID test, and it's going to be COVID. And chances are they're going to go back to the office, infect more people, and then that's going to start to spread around. Some will be fine. Some will get moderate. Some will get severe. You know, it's just going to, the virus will randomly pick and choose who has a rougher go of COVID for many different reasons, whether it be prior immunity, just several different things. Viral load, that's a big one. If you get a bigger viral load, oftentimes those people do end up with a worse case of COVID. It's been proven many times. Norovirus at this time is medium down at this wastewater site in Woodlands, Texas. Shall we look somewhere on the West Coast now? I think we should. Let's see what's going on in West Boise, Idaho. Remember, we had a little concern here? And, well, that concern for COVID, it's dropped a bit, and it's not much of a problem anymore. So that is some good news. Alrighty, folks, I don't want to keep this going forever. If you enjoyed today's virus update, hey, give it a thumbs up. If you're new here and maybe you want to see more of these updates, subscribe down below, hit that notification bell, share this video with anyone you know, leave your thoughts and comments down below, and if you want to support any of my work here on my channel, there are ways to do that down below. Several different ways to support the channel. Alright, thanks for watching, and I will see everyone again next time. Until I see you again next time, stay safe everyone, and have a fantastic Thursday evening. Thanks for watching.